Washington, D.C. is experiencing a crisis. We're among the top cities in the nation in opioid overdose deaths, but there's something everyone can do. You can prevent opioid overdose deaths in your community by learning to use Naloxone, commonly known as Narcan. Proper use of Naloxone can help you save a life. The District of Columbia's Department of Health conducts Naloxone administration training and makes it available at no cost to the public in an effort to reduce opioid overdose deaths in our community. Naloxone comes in several forms. This video will focus on the nasal spray. This video will guide you through how you can help save a life in a potential overdose situation by administering Naloxone nasal spray. Naloxone is a drug that blocks the sedative effects of opioids and can help reverse an overdose. In Washington, D.C., it is legal for anyone to carry or possess Naloxone and to administer it in the case of a potential overdose. DC Health has partnerships with various agencies and pharmacies throughout the district to allow residents to access Naloxone without a prescription. Opioids are very effective at relieving pain. However, taking too much of the drug can cause a person to lose consciousness, stop breathing, and possibly die. There are many kinds of opioids in our community. They come in tablets, pills, capsules, powders, or liquid. They can be swallowed, snorted, smoked, or injected. Here are some of the most common ones. Anyone can experience an opioid overdose, even with opioids prescribed by a doctor. Sometimes opioids obtained on the street or without a prescription are mixed or cut with other opioids like fentanyl, making them extra strong. This increases the likelihood of a potential overdose. Someone is at higher risk of dying from an overdose if they use alone. Some signs that a person is experiencing an overdose include cold, clammy skin, very small, tight pupils, infrequent or gurgling breathing. They are not responsive to shaking or yelling, slow heartbeat, and blue lips or fingertips. What should you do if you encounter someone who you think might be experiencing an overdose? Try to wake the person by speaking loudly or shouting their name.
Michael!
Shake their shoulders.
Is he breathing? No, I can't tell. Okay. Come on, slow. Oh my God. Michael! Okay, good. He's breathing. Oh, good.
If they respond to you, call 911 and stay with the person until they are alert or until help arrives.
Keep breathing, Michael.
If they don't respond to your voice,
is he breathing? Shake him. He's not breathing.
Shake their shoulders or rub your knuckles against the bony part of their chest to try to wake them. This is called a sternum rub.
Call 911. Oh, yes.
Call 911 and tell them that you found someone unresponsive and give them the information they need to send help.
Please send help. Please.
If you suspect overdose, you can give them Naloxone. To administer Naloxone, remove the dose from the packaging. Hold it with your thumb on the plunger and the nozzle between your first and second fingers. Do not prime or test the spray before administering. Gently insert the nozzle into one nostril until your fingers are against the bottom of the person's nose. Then press the plunger firmly all the way to administer the whole dose into one nostril. Do not administer half the dose into one nostril and the other half into the other nostril. Check to see if the person is breathing. Place your cheek next to their mouth while looking at their chest to feel if breath is coming out and see if their chest is moving up and down. If the person is not breathing on their own, start performing the steps for rescue breathing. Tilt their chin up to open the airway. Check to see if there is anything in the mouth blocking the airway. If there is, remove it. Give 2 breaths every 5 seconds until the person starts to breathe on their own. Blow enough air into the lungs to make the chest rise. Turn your head after each breath to ensure that the chest is rising and falling. If it doesn't work, tilt the head back more.
Why is he not breathing?
After Naloxone has been administered, and if the person has still not yet begun breathing on their own, continue rescue breathing until help arrives. If the person is breathing, put them in the recovery position. This is the last step in the reversal process.
Let's get him over.
Roll them onto their side and move their hands under their head with their knees bent. Stay with the person and watch them closely. The recovery position prevents someone from rolling onto their stomach and subsequently choking on their vomit while going through withdrawals. If after 2 to 3 minutes the person does not wake up, respond to voice or touch, or begin to breathe normally, give another dose of naloxone if you have one with you. You may use a second dose of naloxone in the other nostril at this time. In rare instances, certain medications may decrease the effectiveness of naloxone, requiring a person to need more naloxone to recover from an overdose. Naloxone is safe, and adverse reactions are rare. The benefits of using naloxone far outweigh the risks in an emergency. After getting naloxone, a person may immediately wake up and be confused. And because naloxone is blocking the effects of the opioids, they may also experience withdrawal symptoms.
Under your head. Let's get the other one, other arm. Bring it over, come on. Keep breathing. You okay? You're here, you're good. Keep breathing.
A person who has experienced an opioid overdose may refuse medical treatment when they are conscious, so it's important to stay with them and get emergency medical care. If EMS is not called, take the person to an emergency room.
I'm so sorry.
Naloxone doesn't remove opioids from someone's system. It only blocks the effects of the drug and reverses an overdose. This means they may be at risk for another overdose when the naloxone wears off, or if they use again too soon afterwards. Stay with a person for at least 3 hours to watch for the return of an overdose and encourage them not to use again that day. Naloxone is not a substitute for emergency medical care. Be sure to read the packaging inserts and instructions that come with naloxone. They will review how to respond to an opioid overdose and how to properly store naloxone. After using naloxone, place it back in the box and dispose of it in your garbage, out of reach of children and pets. This video does not provide medical advice. It is intended for informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. If you think you may have a medical emergency, immediately dial 911. If you or someone in your life is experiencing a mental health or substance use disorder and are seeking help, call the DC Department of Behavioral Health, 24 hours a day, 7 days a week. This is an overdose prevention video produced by Health HIV for the Opioid Learning Institute. This program is funded wholly or in part by the Government of the District of Columbia, Department of Health, HIV/AIDS, Hepatitis, STD, and TB Administration.